Episode 33 of TCM Graduate TV. I'm Kenton Sefcik. Today we're talking about big, bad, scary stomach one. And before we get going, I just want to warn you that in this video, I'm most likely going to be part rant and then we're going to go part lesson. And I might even edit it that way. So here we've got stomach one. My heavy hitter list has stomach one on it. However, for many schools and for many teachers, they tell their students that this is a danger point. I absolutely abhor the idea that this is a dangerous acupuncture point. Every single 409 standardized acupuncture point is a dangerous acupuncture point if done incorrectly. Today, I want to talk about the 3 ways to keep your acupuncture practice safe. Now, setup is something that isn't mentioned a lot, but angle and depth are mentioned all the time. Setup is important because it's something that we do all the time, but we don't often think about. If you're going to needle UB13, you most likely will have your patient face down. If you're going to needle Yin Tong, you're most likely going to have your patient face up. But what happens when we're going to needle these other acupuncture points, such as stomach 1? We don't think about the setup. This is by no means a replacement for learning how to do these acupuncture points properly. If you don't know how to needle stomach 1, UB1, Qihua, or any other acupuncture point, stomach 9, Ren 22, and you don't feel comfortable doing it, make sure you find a supervisor or practitioner that is comfortable doing it and is willing to help you. I remember the first time I learned stomach 1, and it was in student clinic. My acupuncture supervisor, Alex, taught me how to use this acupuncture point safely. Now, when he showed it to me, I did give him a black eye. That is something that we have to keep our patients aware of, that there's a slight chance that we will give them a black eye by hitting a capillary in the eyelid region. Setting up stomach 1 is quite simple. And again, I can't stress enough that this video doesn't replace learning how to do it live with a supervisor. But just as an example, what we want to do is we want to tip the patient's chin up to the sky, and that will help gravity pull their eyeball downward and away from where we're going to place the acupuncture needle. The other thing we do is we take our 2 fingers, no different than when we squeeze Yin Tong to get a little bit more flesh. Here we're actually pushing the eyeball out of the way and making space for the tube. At which point we're going to place the tube and we're going to take our very sweet time inserting the needle. I've seen practitioners slam that needle in there, and what ends up happening is the patient oftentimes will have a massive black eye. The chances of causing a black eye when moving slowly and applying the right pressure are smaller. Typical sensations from stomach 1 include seeing flashing lights. If the patient tells me at any point in the game that they feel any sharp, pokey, pricky, burny stuff, not a ache or electrical sensation that we're kind of used to or are spreading, but that other sensation that we don't associate with acupuncture, I immediately stop and reposition. Sometimes the patient will feel uncomfortable, at which point I will remove the needle completely. I do stay in the room the entire time the patient has stomach 1 placed in their eye region, and I also get the patient to keep their eye closed the entire time. So that's a huge amount of setup involved in getting stomach 1 to work. And it's the same when we get to stomach 9 and Ren 22. I'll give you some examples of setup. So setup is key to keeping your patients safe. The other 2 things that we use in the clinic more oftentimes we think about are depth and angle. We talk about depth in chun, so that is in anatomical inch compared to the patient. And we know that maybe up here we can go 0.5 to 1 chun. Here in the arm might be 1 to 1.5. Low back might be 1.5 to 2 chun, and maybe the buttock might even be 2 to 3 chun, depending on the amount of muscle mass in the area. If we can keep our depth correct, then we know that we're not going to puncture anything below. The other thing that we use is angle. So we know that we should drop on the scalp to about a 15-degree angle to slip it underneath the skin, between the scalp and the skin. We know that for the upper back, we should angle it 45 degrees. Some people like to go down, some people like to go up. I like to go towards the spine on the inside UB line, and then I like to go outside away from the spine on the outer UB line and make little X's all the way down my patient's back to keep them safe. But regardless of how you'd like to position your angles, but as long as you keep your depth and angle correct, again, you're keeping your patients safe. So now the rant portion is over. I want to get into the lesson part and give you some ideas of when you can use stomach 1. Stomach 1 is a great acupuncture point for any eye concerns. That might be dry, gritty eyes from Sjogren's syndrome. That might be nystagmus. That might be an eye infection, etc. So any eye problems. Now, just because I've been trained to use stomach 1, and just because I'm comfortable using stomach 1, doesn't mean that it's my first acupuncture point that I'm going to jump to. So there's other acupuncture points in the area that my patient will probably feel more comfortable with me needling before I jump to stomach 1. Some of these acupuncture points include threading from UB2 all the way down to UB1. Using stomach 2. Using GB1, or even triple warmer 23. So again, these acupuncture points are great substitutions. A lot of times I'll get a great result with them. Maybe in the case of like Bell's palsy as well, I'll use these first, and then if I have to, I can jump to stomach 1. To add to our prescription, we can add a large intestine 4 because it's a key or command point for the head and face. And I just put H and F there for head and face. There you go. Part rant, part lesson. Hopefully that helps. I really recommend you learn the entire system. Go out there, and if you're uncomfortable with needling an acupuncture point, go get comfortable. Can you imagine the amount of surgeons that started out and they didn't feel comfortable performing surgery on a certain area of the body, maybe where there's intricacies such as nerves and veins and muscles such as the wrist, etc., maybe neck, maybe back, and over time they got good at those things by doing them over and over and building their confidence. And if that I could do anything for you with these videos, again, I go back to this. I just want to give you more confidence in the industry. I want you to get you more confidence in the clinic, because what that does is it feeds back to results and it makes you feel good, and you'll end up maybe researching these acupuncture points, and this is what you're going to do with this. You're going to stop calling acupuncture points danger points. I just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for hanging out with me, and we're going to see you on the next video.